I'm State Representative Justin Simmons, and welcome to my legislative report. Today I'm with Joshua Schnauzer, Director of Operations for Upper Saucon EMS. How are you today, Josh?
I'm well, Mr. Simmons. Thank you. How are you?
Good, good. I had a couple questions for you of your operation here at Upper Saucon. My first question for you is, what type of vehicles do you use?
Right now we currently have 3 custom ambulances. When we order ambulances in new, we're able to customize the cabinet configuration, lighting configurations, the design of the truck as far as paint, graphics, that type of thing. So they're custom built for our service based on our equipment needs and our preferences as far as cabinet layout.
What area do you serve?
We have a primary coverage area that includes all of Upper Saucon Township and the eastern part of Lower Milford Township. We also do mutual aid backup to Coopersburg Borough, Salisbury Township, and several other surrounding communities.
How many people would you say that you serve at this facility?
Our primary coverage area encompasses an area with a population of about 15,000 people currently.
Are you a volunteer organization?
We are a volunteer organization, a 501c3 organization with approximately 20 active volunteers right now who are either serving on a truck as EMTs or paramedics, or they're associate members. Our associates do fundraising events such as pizza sales, flower sales. They help with a subscription drive where we actually do a bulk mailing out to the community to ask for donations and support. And so they play a behind-the-scenes role rather than actually going out on ambulance calls.
How does one go about becoming a volunteer?
The first step is to submit an application. Once we receive applications, we review them, bring people for interviews, and go through the hiring process. From there on, we'll do training, which, if you're going to be actively running on calls, would include getting your EMT certification, first responder certification, or paramedic certification. If you're going to be an associate member, it involves going through training as far as how to do the fundraising and other events that our associates sponsor.
Do you have any professionals here at the station?
We have approximately 15 paid employees right now, 5 of which are full-time employees who work at least 36 hours per week.
What type of training do they need?
Our paid employees have to have, at minimum, an EMT basic training course, which is provided by the Department of Health. It's an approximately 6-month-long training program where you learn basic life-saving skills such as CPR, first aid, proper immobilization techniques. And we also have paramedics who work here who have gone through a more extensive training program that takes approximately 1 year and involves more advanced life-saving skills.
What type of emergencies can you care for?
We respond to many different types of emergencies, anything from everyday calls such as fall victims, chest pain, trouble breathing, to vehicle crashes, rescues. We'll assist with fire calls as far as responding with our fire department to provide rehab services to the firefighters when they are on calls that go on for an extended period of time. And we also do standby events where we'll provide coverage at sporting events in the event that someone would become injured at one of those types of events.
What does the future hold for this station?
Right now we're transitioning to an advanced life support service. We're currently a basic life support service, and this transition means that we're going to be able to offer advanced cardiac care. We're going to be able to offer more treatment on the way to the hospital than a basic life support service can provide.
How do you work with surrounding areas?
We have mutual aid agreements with surrounding areas. For example, if our neighboring ambulance corps is out on a call and committed on a call when a second call comes in, we'll respond in their place and cover that call for them. And they do the same in return for us. If we're out on a call and we don't have a second truck available and we happen to get a second call during that time, they'll respond in for us and handle that call.
How much do one of the ambulances cost?
Ambulances, the cost of an ambulance varies greatly depending on what options are included with that truck. On average, the trucks that we spec out tend to be in the range of $160,000 to $180,000. But again, that varies a lot depending on what equipment's actually included with the vehicle.
What is your total operating budget?
Right now, our operating budget is in the neighborhood of $500,000 per year. With the transition to an ALS service, we of course anticipate that's going to be higher because we have to pay higher salaries for paramedics. We're going to need additional equipment, and we're going to need to maintain more equipment than we would as a basic life support service.
Where do you get your money from?
The majority of our funding comes from the billing for services. When we transport patients to the hospital, we bill their insurance companies or Medicare, and in addition to that, we also have a subscription drive. Each year we send out a mailing to the residents in our primary coverage area asking for their support. It acts as an insurance policy almost.
Sure.
If we transport somebody to the hospital who's a subscriber and their insurance doesn't fully cover that transportation, we end up waiving the rest of the bill. And we also ask during that subscription drive that people give additional donations. And so we receive a lot of support from our community. More than 95% of our income comes from either our subscription drive or from billing. We receive very few or very little tax dollars, unlike other government agencies. We don't receive tax dollars like police or fire departments.
How long has the station been here?
Upper Saucon Ambulance Corps was initially formed in 1976 as the Upper Saucon Township Volunteer Fire Company Ambulance Corps. Then in 1983, the name changed to Upper Saucon Ambulance Corps, and in 1990, we actually moved into the facility where we're currently at now on Camp Meeting Road.
How can the state help local EMS organizations out?
One of the things we've seen in the past few years is a decline in volunteerism. We would certainly ask the state to help out with incentivizing volunteerism to help get more volunteer members into our organization. There's a lot more training involved than there used to be. There's a lot more time commitment than there used to be. And so we've seen a steady decline in the number of volunteers that we have that actually are willing to commit to getting the training they need and to responding out on calls with us.
Thank you, Joshua, for your time today. And that's all the time we have today for my legislative report. For more information, please visit my website at www.repsimmons.com. Thank you.